CO2 risk analysis of indoor airborne transmission of SARS-CoV-2 in Starbucks, presented by Jess G, Aisha J, and Aleksandra S. In the course of our analytical research, we set out to answer this question. Do Starbucks locations in different cities reveal socioeconomic disparities of SARS-CoV-2 risk? Over the duration of the coronavirus pandemic, which began in 2019, researchers discovered that most populations facing the highest risk for SARS-CoV-2 transmission were low-income populations due to variables like work environment, crowded households, transportation, disability, and access to information, as well as personal protective equipment like masks. Further into the pandemic, researchers noted that the most effective mode of transmission of SARS-CoV-2 was by aerosol, which is why counsel from institutions like the Center for Disease Control and the World Health Organization centered around mask wearing and social distancing. Our research set out to determine if transmission risk by aerosol, measured in proxy by carbon dioxide concentrations due to the presence of suspended particles exhaled by people in indoor spaces, reflects socioeconomic differences between cities with varying average household incomes. While there are no hard and fast rules for what safe concentration levels look like, most studies to date have determined that indoor concentrations of CO2 over 1,000 parts per million are considered unhealthy. Some countries seek to keep CO2 levels at or under 700 parts per million.
To conduct our experiment, we each needed our own CO2 monitors and accessibility to a standalone Starbucks. To collect data, we waited outside of a Starbucks for at least 1 minute to get the initial outdoor CO2 levels. Upon entering the Starbucks, we took note of the amount of persons in the store, were these persons masked, and if the door was left open. We remained in the store for at least 10 minutes after our initial entry time. We then utilized this raw data to compare it to our median household income for each city. We collected data from Redmond, Linwood, and Seattle.
So we chose 3 Starbucks locations: Linwood, Seattle, and Redmond. We took CO2 reading and compared our findings against average household income. We did not find a correlation between those data, even though the contributing factors such as store size, ventilation system, number of customers were similar. Our collected sample did not support our hypothesis that the median household income correlates with higher average CO2 level in the coffee stores. Our sample simply was not representative. We need more data. We only could conclude that it is safer to take your coffee for a walk.
Here is a list of our resources, and we would like to give a special thanks and acknowledgements to our professors and our mentors, Dr. Kaylin Owens, Ann Murkowski, and Sarah Fenton. Thank you.